Kalani. I'm a student physical therapist for Midwestern University, and today we're going to do a cardiopulmonary patient encounter. So, I'm going to be talking through some things like I would as a video, but I'm mainly going to be focusing on my patient, Emily, here. Hi, my name is Kalani. I'm a student physical therapist.
Hello.
How are you?
Good.
Good. Good. What's your name?
My name is Emily. I'm a 45-year-old woman, and I was recently diagnosed with imminent hypertension.
Okay.
Um, so yeah, I came in here because I would like to explore some holistic remedies, some lifestyle type changes before I turn to medications.
Oh, awesome. Amazing. So you've seen the doctor previously. They didn't give you a referral, you just walked in kind of a deal?
Correct. I met with the doctor about 3 weeks ago, and he gave me the diagnosis, and we talked through some options. And then my grandkids, they showed me some Instagram reels about physical therapy and how it might help with hypertension. So I googled you guys, and I
Oh,
just walked in.
okay. Amazing. Well, we're glad you're here. Um, let's just talk a little bit more about your symptoms. Have you had any like shortness of breath? Do you have a hard time sleeping?
I have had some shortness of breath, and that's why I'm wearing this oxygen tube
Okay.
in my beard.
Okay.
Um, but I've also had occasional headaches.
Okay.
The doctor said that that could be related, but he said that it also could be related to my weight.
Okay. Okay. All good things to know. So just to recap, you're looking for a holistic approach. You kind of want to try this before medication. Um, what are you looking to get out of our session today?
I would just kind of like to see what my options would be moving forward with your procedures,
Okay.
if there are treatments aside from pharmaceuticals, and changes that I can make to my lifestyle to help remedy the hypertension,
For sure.
as opposed to getting on some kind of heart medication or like blood thinners or something.
Yeah, for sure. Did the doctor tell you much about hypertension and kind of what it is at all?
Not really. I have a basic understanding of it
Mm-hmm.
being, like an increased heart rate and blood pressure,
Mm-hmm.
and so it's putting more strain on your arteries
Mm-hmm.
and on the heart itself. But that's really the extent of my knowledge.
Yeah. So a lot of times, like hypertension is explained that way, which is not incorrect. That is correct. It is possible for us to kind of manage those symptoms, and sometimes it is reversible with lifestyle modifications.
Oh,
So we're really
interesting.
glad you're here. But it just depends on how motivated you are. And we can work around what you feel is best for your life and what fits with your goals. Is there anything in your life that this limits at all?
Um, as in my hypertension limits.
Yeah, like do you have like are do any of your symptoms that you feel limit like any of your hobbies or getting a good night's rest, kind of things like that, like
Yeah.
playing with your grandchildren, anything like
Yeah, I definitely don't feel like I sleep very well.
that? Mm-hmm.
I'm on a CPAP machine,
I see.
and um, I don't know, that's I've always had a harder time sleeping.
Okay.
But my husband is an ultra marathon runner,
Mm.
and I would like to get into that with him. He just ran a 300-mile race
Wow.
in the range of Kilimanjaro.
Wow.
Yeah, so I would like to be able to do that with him, but my hypertension just really gets in the way.
I understand. Okay. Have run before, yes or no?
No, never a day in my life.
Okay. So we'll start slow, but we can see what we can do to get you there.
Perfect. He has another race coming up in like 2 months, and I was hoping that we could maybe do something with that. No,
Yeah.
if not, no, that's okay.
Well, it's okay. We can see where we're at, but I feel like we should just stay in a realm that's realistic for us right now.
Oh,
We
okay.
just want to be able to manage your symptoms. We can check back in like a month and see how you're feeling,
Sure.
but definitely a really good long-term goal.
Okay,
Yeah,
perfect.
definitely.
That makes sense.
Perfect. So with your goals and your plans and the things that we've talked about today, I just want us to be on the same page about what hypertension is and how what I'm going to do with you is going to help.
Mm.
So basically, like you said, hypertension raises your blood pressure and your heart rate um, at rest. So you're already sitting a little high, which puts a lot of work on your heart. Like there's a workload on your heart that it has to overcome to go through your veins, right?
Mm-hmm.
And with hypertension, a lot of other things can go wrong. So I just want to screen you today to make sure none of those things are already happening.
Sure.
In the medical world, we call hypertension the silent killer just because people don't feel it until they feel it. You know what I mean? So I just want to screen a few things with you today just to make sure everything's working properly and that we are cleared to do exercise today, because that's a really good way to help decrease those symptoms, because your heart is going to get used to pumping at a normal rate and level. Does that make sense?
Yeah, that totally makes
Do you
sense.
have any questions about that?
No, I don't think so. I think you explained it very well.
Okay. All right, so now we're just going to check some vital signs. We're going to go through lung auscultations, heart auscultations, blood pressure, heart rate, and O2 saturation, just to check some vitals while he's at rest. And then we'll do it again when we do our outcome measure, our 6-minute walk test. Okay, so first we're going to do blood pressure. Is this the arm that they normally test on, or do you have a preference?
Usually it's my left arm.
Usually it's your left arm. Okay, so this one.
Yeah.
Amazing. Just gonna find it right here, your little artery. Is that tight enough?
Yeah.
Okay. Okay. I'm just gonna stick this right here. All right. Okay. Stay nice and relaxed for me. You're just gonna feel a little bit of pressure. So go all the way up. All right, so I got 148 over 70, which is just a little bit high. So I'm just gonna give it a rest for a few minutes. I know you came in with hypertension, but I just want to be doubly sure that this is like a correct number. So we're gonna give it a rest for a few minutes, and then we'll come back and take it again. Okay. Now that we're back, it's been a few minutes. We're just gonna recheck it right back here. You still doing okay?
Yep.
Okay. Okay, so it just went a little bit lower that time. It was 145 over 72, which is a little bit lower, so but still in that range. So we'll just kind of work with what we have here, and we'll probably take it again while we do activity just so we can monitor. Let's take your O2, your oxygen, since you've been put on oxygen recently. We'll just kind of take that out of your nose here so we get an accurate reading. Okay. Very nice. We're seeing 95, which is normal, but in a hypertensive patient on oxygen, we might see it a little bit lower. Normally around 90 on room oxygen is where it could sit. And especially since he's been having headaches, could be a potential reason why is her oxygen might be a little low. Okay, and now we're going to take Emily's heart rate and see if it matches. Okay, so he's just within that normal range. We got about 80 beats per minute. He's just on the top end. Emily is just on the top end. So it is a little bit high. I would say that, our treatment today will help also lower that heart rate down. And it does check out. It's about 84 beats per minute here. So we're very consistent. All right, so now we're going to do auscultations. So all right, Emily. So what we're going to do is we're going to go we're just going to listen to your heart sounds to make sure everything's going okay, and then we'll listen to your lung sounds as well. Okay. So just for the heart sounds, I'm going to need to be skin on skin. Is that okay if I go on your skin?
Sure.
Okay. I have you in a gown. Do you feel comfortable removing it, or would you like to keep it on?
I think I'd like to keep it on.
Okay, sounds good. We can do that. All right. So I'm gonna go in with the diaphragm first, and that'll show me that you're ticking normally, and then I'll go in with this other side called the bell, and that'll tell me if there's anything abnormal going on. Okay.
Got it.
All right. All right. I'm gonna go under. Is that okay?
Mm-hmm.
All right. Go up towards the top on the right side first. Wonderful. And then I'll go across the way on the other side. And we'll go down, still on that left side. And for this one, I'm just gonna need your help moving your breast tissue away so that I can get an accurate sound. Is that okay?
Sure.
Okay. Yeah, so just go ahead and lift it up for me. Move your hand that way. There we go. This way. Perfect. Awesome. Okay. So everything looks normal there. I'm just going to go in and make sure that there's nothing abnormal going on. Okay. So same thing. All right. Same thing. Same procedure on that part. Just go ahead and lift it. Everything is normal. Awesome job, Emily. Any questions for me about that?
Nope, I don't think so.
Awesome. Okay, Emily, now we're going to do some lung auscultations, which just means I'm just going to listen to your lung sounds now. So during this one, I know you're on oxygen and it can be a little hard to get some air, but we're going to breathe in through your mouth and out through your mouth just so I can get a good hearing of what's going on. And I'm going to do it on the front side and on the back side. So we'll practice one just over the chest so you can kind of feel what I'm going to need. So I'm going to go this way, this way, this way, this way, all the way down and around, okay, to the sides of your lungs. And on each place, you go in for the deep breath, out for a deep breath. All right?
Got it.
Make sense?
Got it.
All right. Do you want me to practice over, or do you just want me to go for it?
Let's just go for it.
All right. Let's just go right under you. I'm going to move your necklace if that's okay.
Yeah.
All right. All right. Go for it here. Okay, last couple. And the other side. Really good. How do you feel?
Good.
Nothing abnormal there either.
Sweet.
So, really good job. Do you need me to take a minute before we do the back? Are you feeling okay?
I'm feeling good.
Okay. Okay, Emily. Now we're going to do the same thing, but on the back. Are you ready?
I'm ready.
Okay. I'm just going to move your line just over this way. Is that okay?
Yeah.
All right. Just don't want it to get in the way. All right. Go for it. Wonderful. Emily, you did a great job. I didn't hear any abnormal signs there either. Abnormal sounds. All right, Emily. Now I'm going to do one additional just screening measure just to make sure. I'm going to just have you lie down on your back. I'll take your oxygen tube with me. Okay. Just keep it on slack here. Feel okay?
So comfy.
All right. I'll just set it, this tube right there, okay? Okay, Emily, what we're gonna do now is we're just gonna look at your lower body just to make sure there's no edema or swelling down there. Just because I know with hypertension, it often leads to cardiovascular disease, which then often leads to heart failure. And with those things comes like pooling of blood in the legs and just fluids down there. So I just want to make sure that everything looks okay and that your circulation is okay. Does that make sense?
Sure.
All right. So is it okay if I take your socks off?
Yes.
All right. All right. I'm going to roll your pant legs up. We're just going to check for that pitting edema. And everything bounces back correctly. Just in a few places. And I'm also going to check your circulation down at your toes. Are you ticklish?
Sometimes.
Okay. I'll make sure to put a lot of pressure on it so you can't feel. And everything seems to be refilling properly. Really very nice. How's your sensation down here? Do you notice any feeling lost?
Not lost, no.
Okay. You can tell between hot and cold, sharp and dull.
Yeah, most
Okay.
of the time.
All right. And then I'll just refill those toes. No pitting edema here. And you refill within 3 seconds. So you're doing great, Emily. Now our outcome measure that we have chosen is the 6-minute walk test. Mainly because we want to see Emily work at a rate that is best for her, as well as see how she does with endurance, because that's one of her goals, is to run long distances with her husband. So we want to do a 6-minute walk test to see how far she can ambulate safely and how many breaks she takes, and monitor those vital signs as well. It's a really good comprehensive test, just to see how she's doing generally with her hypertension. So the way we would perform it is if we set up some cones 12 meters apart, and then we'll just have her start. We would walk behind her so we don't set a pace for her. She would set her own pace. And then we would set that timer for 6 minutes. We would give her instructions not to sit down, but if she needs to take a rest, she can do that standing. And then we would just record her mileage or meterage when the 6 minutes are over. And we would have a chair ready for her if she needed it. And for her vital signs, we would take that during the beginning, pre-exercise. We would take it in the middle, during exercise at its peak, and then right after she finishes the test. And then we would take a recovery one as well, just to make sure that her vital signs are going down in the expected way. Because we don't want to see a diastolic blood pressure drop right in the middle of her peak exercise. or we wouldn't want to see heart rate increasing right after she finishes exercising. So we just want to make sure everything is normal there, and just making sure we document that. Okay. Hi, Emily. So what we're going to do now is we're just going to assess your general tolerance to movement. So I'm going to just take you walking, and we're just going to look at a couple of things. I want you to walk as normally as you normally do. Okay. Um, as you have been with this in your life, or these symptoms, and been on oxygen and all that stuff, have you found it harder or easier to move around, or?
Definitely not easier, but it's more like I feel winded,
Mm-hmm.
or like my joints will ache a little,
Mm-hmm.
but it's not like I don't go like numb, or have like this crippling pain or balance
Mm-hmm.
issues or anything like
When you feel winded, do you normally stop and rest
that.
to catch your breath?
Yeah, I haven't been doing a whole lot of like really long distance things, but it's like, if I'm doing chores around the house, um, after a couple minutes of running around,
Okay.
20, 30 minutes or whatever, I'll sit on the couch and kind of relax for a little while.
Okay. Um, do you feel like, because of your shortness of breath, or stuff like, or stuff that's going on, do you feel like that hinders your motivation or ability to do things around the house?
Oh, definitely.
Okay.
Yeah. Yeah.
Okay. We'll talk more a little bit about that later. I have some techniques that you might be able to use around the house and take home. We can teach you some of those. But for right now, I'm going to just put this gait belt on you just in case. Um, I'm not saying that you're incapable or anything like that. I just want you to feel comfortable and me to have the tools necessary just in case, I need to catch you or something like that.
Sure.
All right. So I'm just going to ask you to make your arms like a T. Just gonna make sure that line doesn't get locked in there. The only way I remembered how to do this was through the alligator's mouth, and then it digests it. Poops it out. Thought you might laugh.
I did laugh.
Awesome. So I'll take your line with me, and I'll just be behind you, okay? So go ahead and stand up, and all I want you to do is walk down and back for me. If we went faster, do you feel like anything would change?
Um, no, except that I might just get tired if we did that for a while.
Okay. Right on. So for my patient, during that analysis, I felt like their gait looked normal, and that their activity tolerance was good. However, I do feel like that it can be improved. So there is a need here, and we will work on that in our interventions. All right, Emily. So I know you're talking about how you were getting shortness of breath and it was hindering you trying to do things around the house, just with your oxygen levels and all of that. So what I want to do with you today is I'm going to teach you a breathing technique. It's called pursed lip breathing, and I'll show you a couple of different body positions also that might help while you move around the house to save your energy and focus on expanding and shortening your lungs and getting the oxygen you need. Does this make sense? Do you have any questions before we start?
No.
Okay. So for pursed lip breathing, it's kind of exactly how it sounds. You're gonna make your mouth like a whistle motion, and you're gonna breathe in and out. Good. Yeah. Good. So it kind of just traps the air so that it's like slowing it down, essentially, so you can get enough and it'll get to the places, the tissues that it needs to get to. Okay, and I just wanted to show you something else just in case the pursed lip breathing wasn't enough. So stand up next to me, and so if you have a counter or something at home when you're doing dishes, you can always, here, we'll use this. You can always lean up against it just like this So it'll put your body in more of a flex position, so it'll take tension off of structures so that you can have the air available to you. So go ahead and try it for me. You can put one foot in front of you. Yeah, there you go. So you want to have your hips flex back. Yeah, just like this. So if you're doing dishes, you can just lean up like this. It doesn't have to be super postural or anything, but just like, and you can practice your pursed lip breathing here just in case the pursed lip breathing alone is not enough. How's that feel, Emily?
Feels a lot better.
Good, good. Okay, so this is something you can take home with you when you feel those symptoms coming on. Yeah, amazing. You're doing great. Okay, Emily. So we've talked a lot about a lot of different things. I just kind of want to touch base with you on like the activities that you already do at home and what we might be able to add or take away to make your life easier.
Sure. Usually I try to start my day with a walk, just kind of down to the end of the cul-de-sac and back. And then other than that, it's really just housework. I do the dishes and the laundry and, take the kids to the park or whatever and to school. And I clean and things like that.
Okay. So on your walk, because I know you talked about like wanting to run a little bit more. So on your walk, how long do you normally go?
Usually it's about 10 minutes, maybe 15.
Okay.
If I'm feeling good.
Okay. When you say if I'm feeling good, like what do you feel like by the end of 10 minutes you're really like fatigued or?
Yeah, it's not like oh, I'm just so exhausted now. It's more just like I'm not breathing heavy and I'm not sweaty, that kind of thing.
Okay. So you're looking to get your heart rate up?
Yes.
Okay. So do you think if you either like went a little faster or you walked a little longer, would that help you?
I think so.
Okay.
Yeah, I'm trying to work up to 20 minutes right now, as in 10 minutes out and 10 minutes back. But yeah.
Okay, so why don't we set that as one of our goals? If like within 4 weeks we could have you maybe doing 15 minutes out.
Sure.
Like 7 there, 7 back, or something like that.
Yeah.
And hopefully without needing to take any breaks. Because the goal really is to help you get your heart rate up so that your heart can learn how to pump more efficiently. And so we recommend like aerobically for hypertensive patients, like you would do it 5 to 7 days a week, whatever that looks like in your schedule. Just try and get out 5 to 7 days. And we do recommend like moderate to light. And so that's like around 40% of your max heart rate. And we took that, right?
Yeah.
So it's like 220 minus your age.
Right.
So you can figure that out at home too.
Sure.
So whatever that looks like for you. So 40%, 40 to 60% of that, or if you'd rather use the scale, the rate of perceived exertion scale, it's usually like a 12 to 13 on there out of 20.
Okay.
And I can send that home with you too, so you can kind of look at it.
That'd be great.
All right. So does that sound like a good goal?
Yep.
Like within 4 weeks we do that?
Yep.
Okay.
Awesome.
All right, 15 minutes.
Perfect. Thank you, doctor.
Of
Appreciate
course.
it.